Yeah. Okay. Good morning, folks. Thanks for coming. Today we're launching the first in a series of public information sessions. Our intent is to inform our patients and the public about the challenges facing our healthcare system, including the gaps in medical services and delivery. We want to present our issues to the public so that the people of the province can understand exactly what is at stake if we fail to address the deficiencies in our medical care system. Today we'll be examining the issues surrounding general internal medicine. I'd like to introduce our panelists, Dr. Joshi to my right, Dr. Anwar to my left, and Dr. Trey on my right on the end there. These physicians work tirelessly every day to provide the best possible care to their patients. Unfortunately, they are functioning in a system where general internal medicine has been plagued by serious shortages, as we have recently witnessed in media coverage of the interruption in internal medicine services in Clarenville and Bonavista. I'd like to note that we invited two general internists from Carbonear and Grand Falls, Windsor, to be here today to talk about issues in rural practice. However, due to a shortage of staff, they were unable to be here. They chose to put their patients first. Each day that the system continues to function without correcting the problems the medical profession has identified increases the risk of compromising patient care and patient safety. Patients in this province are entitled to a reliable healthcare system that delivers effective care every day. They should be confident that the care they receive meets the highest standards of safety and quality. We're raising these issues today because doctors in this province are extremely worried about the gaps in medical service delivery and how long our patients are being made to wait for general services, which encompasses things like assessments, diagnosis, procedures, and treatment. As physicians, we have a duty to not be complacent whenever patient care is at risk and to communicate our concerns about patient care publicly and truthfully. After each panelist has made their statements, we'll open the floor to questions. So I'll turn it over to Dr. Joshi, who's the Chief of Medicine at Eastern Health, to discuss physician recruitment. Dr. Anwar is going to discuss rural coverage, and Dr. Trey will discuss tertiary care and the overall solutions. So I'll turn it over now to Dr. Joshi. Thanks for coming today.
Thank you, Dr. Lewis. Good morning, ladies and gentlemen. Currently, there is a significant shortage of general internists all across Canada. So who are these general internists? They are physicians who specialize in adult medicine. They have detailed knowledge and skill sets that enable them to approach the whole patient to diagnose and treat complex medical problems. General internists usually care for seriously ill patients in hospital and also those needing outpatient management and follow-up of multiple and complex problems. They bring forth a broad-based expertise and a holistic approach to patient care rather than focusing on a specific organ system. You can think of a cardiologist who focuses on the heart and a nephrologist who may focus on the kidneys. So general internists are more broad in their outlook. Now, it has been estimated that there are approximately 2,500 general internists in total in this country. Of these, over 24% are over the age of 55, and almost 23% are over the age of 65. So as many of these internists approach retirement age, between 60 to 100 new recruits will be needed annually to maintain the current workplace complement. With the aging population, the need for general internists is going to be even greater. So this gives us a glimpse at the demand side of the equation. In terms of supply, the number of medical residents completing their training in general internal medicine has fallen from over 60 per year to less than 20 per year across Canada since the mid-1990s. There's therefore an urgent need to rectify this imbalance if we are to avert a looming disaster in healthcare. Closer to home, there are 27 full-time practicing physicians, internal medicine specialists in Newfoundland and Labrador, with 10 of them in St. John's, 4 in Cornerbrook, 4 in Gander, 3 in Grand Falls, Windsor, 2 in Stephenville, 2 in Carbonear, 1 in St. Anthony, and 1 in Clarenville. Unfortunately, there are no full-time internists in Burin or Labrador. So whenever one or more of these physicians are away for one reason or another, there's a potential for a gap in medical coverage that can impact comprehensive care and safety of a patient. In addition, some of these patients get transferred to St. John's, which puts additional strain on the resources at the 2 adult hospital sites, St. Clair's and the Health Sciences. In terms of retention, of the 27 general internists practicing in this province, 23 are international medical graduates. More than half of all the province's international medical graduate internists are practicing with provisional licenses. The provisional licenses allow them to practice in underserviced areas while they complete their Canadian licensing requirements to practice medicine anywhere in Canada. So unfortunately, it does not always lead to long-term retention for the province. Lack of competitive remuneration is certainly one big factor in ensuring recruitment and retention. Other factors, of course, include lifestyle considerations and employment opportunities for the spouse. Now, I've been in practice in St. John's since 1982. I do really enjoy my work, and it has been a privilege to serve this community. And I do hope that I've made a difference to someone somewhere. Over the last few years, I've found that there has been a dramatic increase in my workload. It seems I'm working harder and longer every year. My wife says at least I'm doing some good somewhere. I suppose it is not surprising that my workload has changed, given that there has been a significant increase in the population in St. John's and the surrounding areas. I've also noticed that I'm looking after more seniors with complex medical problems requiring close attention and more time. And as we gain in medical knowledge and options for treatment expand, I'm finding that family physicians require more support from the internist to effectively treat their patients. Yet there are only 5 internists in St. John's who provide support outside the hospital setting. The rest provide care within the 2 hospitals that we have in the city. Another major challenge for me is access to beds in the hospital. Sometimes it's so bad that even when I admit patients to hospital, they have to wait in the emergency room for several hours to days before they can be transferred to the ward. So in closing, there are indeed privileges and challenges within our healthcare system. And what I'm looking for is someone to help me to serve my patients better. Thank you for your time and your attention.
Thank you, Dr. Joshi.